Hi there and welcome to my talk. My name is Ulrike Stiefelhagen and I am currently associated with Fraunhofer IAIS in St. Augustin, Germany. I am here today to present voice AI applications in two domains, both domains considered to be challenging for voice interactions, namely healthcare and industry. That's why I called this section Gen AI voice use cases in difficult scenarios. In the next 10 minutes, I will point out typical challenges for voice interaction in difficult scenarios, the opportunity of voice generative AI, and I will illustrate it with examples of applications, namely two. The first one is Yuki in the hospital's patient room and helping Harry on a factory's shop floor. What do I mean by difficult? Here I'm hitting on typical impediments for voice-only interfaces, for example, handling private or sensitive data like patient health data, or pursuing robust voice navigation in loud environments, as is the case on a factory shop floor. We also encountered more impediments with using voice Gen AI during the project. We had difficulties with the speed of interaction and also with the size of turns. Text versus voice are good for different sizes. But yeah, I have to admit that we did not solve all the problems, but I intend to highlight opportunities for voice as a value-bringing modality, especially in concoction with generative AI. The solutions so far seem to be keep data safe on local server, host the LLMs locally, take care that interaction takes place without being overheard, use one-time passcodes for access to certain services, and also use headsets, use a mix of voice and alternative modalities, for example, mix text or touch with voice. I will start with the first example domain, healthcare. Here we developed the patient's voice assistant, Yuki, and we encountered two types of challenges, voice UX challenges and security and privacy challenges. To start with, Yuki is an agentic setup. It's a mixture of curated information, RAG, retrieval augmented generation, which is controlled, the information is controlled by the hospital, and free chatting, of course, with guardrails. The voice UX challenges we encountered, or I want to highlight, are that transparency is difficult, more difficult with voice than with visual UIs, because giving sources for answers is much easier in visual UIs. Giving transparency and traceability or explainability is pretty important in interacting with AI. It is more difficult with voice to guide patients in being critical to AI errors. This kind of contrasts with voice as a modality. Voice as a modality is intended to be quick and easy understandable versus having to keep a critical perspective on topics. Yeah, this is kind of opposing. Second UX challenge I want to point out is that using Gen AI may undermine the hospital hierarchy of interacting with humans, in our case, care personnel, as it is less personal. But patients are needed to be obedient to hospital recommendations, for example, not eating before certain operations because it's important for the outcome. And the second type of challenges are the data security challenges. We noted that privacy is infringed upon commonly in hospitals. For example, people in need agree readily to give away their data for help in return. Second, overhearing roommates in hospital has been common. Anyways, as a third point, the hospital information needs to be targeted at each patient, so it's personal. For example, prescriptions vary, especially for people with multiple or complex issues, and hence the need of an assistant being able to curate information. The status quo in hospitals still is that trust in the correctness of the operation procedure is still deemed to be helpful. Thus, an assistant needs to be able to control dissemination of information to the right patient, while ideally also taking into account the audience in the room. On here on the right side, you see the UI, which was added in the setup to the voice system Yuki. Two of Yuki's features that rose out of the AI capabilities were the patient diary and summarization feature and the translation of the doctor's report. Let's go first to the patient diary and summarization. In order to support the self-efficacy and self-healing of patients, self-monitoring is deemed to be important for patients. They can monitor their personal development by doing diary entries, either by their own wish or as a demand from a doctor in a pain diary, for example. So it's can be used to give immediate pain documentation or making immediate diary entries. And the summarization feature, which is a classical AI use case, thereby people can retrieve the development over the hospital stay and also take a better look at their development themselves. The second feature I want to highlight is the translation of a doctor's report. And this is much easier with AI, as doctors do not want to be recorded at their workplaces during the visitation hours. But you can allow doctors to tick off the information that is going to be free for the assistant, and then you can generate the information on demand for the patient. So the process is that doctors authorize the information via the hospital software, and the system can give out the documented information as natural spoken language, including translations and also easy language. So making sure that people understand and are not time dependent anymore. So it's important to make the information available for a diverse range of patients. For example, for people who are not that fluent in the German language. Also in emphasizing a recommended or compulsory course of action, like I said before, keeping a diet before operations, and thereby heightening patient cooperation. Both were like pain points reported from the care personnel before. Okay, then I come to the second example domain, manufacturing. And there we developed an assistant to support people working on the shop floor. The people do mainly screwing, but it's important which screw when and where and with which torque to screw. The worker's assistant has been called Helping Harry. Actually, it consists of two modules. I'll come to this later. And I also collected voice UX challenges and data challenges. The voice UX challenges include that many information on the shop floor are visual or are long numbers, which are difficult to check via voice. All the parts have numbers of 10 to 15 digits, and this is difficult. The second, the personnel is mostly non-native speakers of German. And thirdly, and most importantly, the environment is pretty noisy, and the noise is of different qualities. It may disturb both the input as well as the output for the non-native speakers. The data challenges were that so workers demand for orientation on the shop floor and also central and timely access to information, but the data is scattered and also partly on paper. So the data needed to be harmonized and made accessible on the shop floor. So we developed two modules within one project, like for two different stakeholders. You see the UIs on the right side. The first one is a daily summary, AI summary, and the second one is an onboarding assistant to new workstations. So yeah, those were modules that can could be combined in one assistant. The daily summary, which I will start with, informs about relevant information of the coming shift and on the coming manufacturing order. It's incorporated into the local IT structure using in-house LLM access, and it is triggered via indoor GPS on the shop floor. Here we have a button trigger system for the demo. And the second module is the onboarding assistant. It's based on work step descriptions by the planners on the shop floor. So the steps of each worker are planned in advance to build a specific part. And here the breakthrough for the workers who have to work hands-free because they usually have to do something with their hands was a bone conduction headset. It's lightweight, flexible to shut down other noise, and robust after on-site tuning. And we configured the system with the workers together, and it still is individually configurable and extendable for the team leads to different workstations. So what you can configure is loudness of warning sounds and speed of the speech output, for example. Also, you can tune the ASR with a low-code configuration interface. So on what were the opportunities? We took the daily summary, offers a flexible and timely low maintenance system. So it's important that the team leads can configure the AI output, they can configure the prompt, they can configure the data that is used to generate the output, and the information that goes to the people working on the shop floor is timely. So there's no time lag, and also there's low maintenance, and it's included into their own system. The second one, the onboarding assistant, is highly recommendable because it's adaptable to workforce capabilities. The company in question reported that there are different capabilities and that they need to adapt to this. So we designed the system to be able to adapt to each target group. Thank you very much. And if you have questions, feel free to ask them.